05S attention, picture a pill that could tack on years to your life, no injections, no fuss, just pop it like your daily meds. Beat Visual 510S authority, hey there, I'm Walter Crane, been a science scribe for a solid 10 years, turning jargon-heavy study findings into stuff regular folks can actually get. Beat TextPop 1015S, agenda, stick around, cause we're about to unpack how one gerontologist, that's weird moment turned a run-of-the-mill diabetes pill into a legit contender for a longevity game changer. Beat Zoom 1530S disclaimer, quick heads up before we jump in, what you're about to see is rooted in real research, but I'm giving it my spin, names tweaked here and there to keep things tidy. Beat Tonal 3045S. First source, Metformin, the go-to oral diabetes drug that doctors hand out like candy, has had longevity researchers whispering for ages thanks to its sneaky side effects. Source, FDA, Metformin is currently approved for the treatment of type 2 diabetes. Beat Visual 4555S, introduction to the discovery, fast forward to last year. Dr. Alina Morales, a top-tier gerontologist, noticed her diabetic patients on metformin seemed to dodge aging's usual potholes way better than their metformin-free peers. Beat TextPop 5565S observational clue, her clinic's digital files were screaming the same tune, fewer heart scares, sharper minds, and way less frailty in the metformin crew. Beat Zoom 6575S researchers' reaction. At first I chalked it up to better glucose control, Morales admits, but the numbers were screaming louder than my gut. Beat Tonal 7585's initial hypothesis, she started wondering if metformin wasn't just taming blood sugar but maybe tweaking the deeper gears that control how fast cells age. Beat Visual 8595's turning observation into study, so Morales rounded up a dream team, epidemiologists, lab wranglers, and docs to run a pilot that might actually prove her gut feeling right. Beat TextPop 95105's clinical trial launch, they signed up healthy folks over 50, split them into two groups, one got a low-dose metformin hit, the other got a sugar pill, and then watched their aging biomarkers for years. Source, clinical trials, Gov. Several clinical trials are investigating metformin's potential in aging and age-related diseases. Beat Zoom 105-115S, early indicators, the early readouts. A slight dip in inflammation and mitochondria humming like they were 20 again, both big deals in the anti-aging playbook. Source, Science Direct, metformin's mechanisms of action may contribute to its potential anti-aging effects. Beat Tonal 115-125's expert commentary matches up neat with what we've seen in mice and rats, says Dr. James Patel, a geriatrician who wasn't part of the trial. Beat Visual 125-135's context of aging research, anti-aging science, is exploding right now. Governments everywhere are throwing cash at anything that might delay a whole laundry list of chronic diseases at once. Source, NIA, aging research is a rapidly evolving field, with metformin being one of the areas of investigation. Beat TextPop 135-145's potential impact if metformin pans out. It could become the first ever pharmacy shelf item that doesn't just fight disease, it actively helps you stay spry longer. Beat Zoom 145-155's economic relevance. Imagine the healthcare budget shuffle, billions that once bankrupted families treating late-stage illnesses could instead bankroll keeping folks mobile and independent. Beat Tonal 155-165's public expectation. Morales's early buzz got the media into a frenzy, headlines everywhere blared. The pill that could slow aging. Beat Visual 165-175's scientific caveat, but here's the kicker. The science squad still holding the wait-and-see sign, no drug, nailed down a clear, repeatable win for human lifespan yet. Beat TextPop 175-185's, what we know so far, metformin's main gig is beefing up insulin sensitivity, but its side hustle, messing with cellular metabolism, might just slam into the same levers that pull aging strings. Source, NCBI, metformin has been shown to have potential anti-aging effects. Beat Zoom 185-195's mechanistic hints, lab work hints it fires up AMPK, a cellular energy cop that helps cells cope when power's low and might dial back the rust that comes with age. Source, Science Direct, metformin's mechanisms of action may contribute to its potential anti-aging effects. Beat Tonal 195-205's limitations, still these clues are baby steps born in Petri dishes, getting them to work in healthy humans, that's a whole other mountain to climb. Beat Visual 205-215's stakes for the future. The stakes huge. A proven anti-aging therapy could stretch the chunk of life we spend feeling sharp, reshaping how we picture retirement, caregiving, and chasing our dreams way past 70. Beat TextPop 215-225's regulatory pathway bonus. Metformin's already FDA cleared for diabetes, so slapping an anti-aging label on it might not mean jumping through hoops like a brand new drug. Source FDA Metformin is currently approved for the treatment of type 2 diabetes. Beat Zoom 225-235S global interest from Washington to Brussels. Governments are writing checks for anti-aging studies and Metformin is sitting pretty at the top of the invite list. Beat Tonal 235-245S next. STEPS, the big leagues are stepping up like the TAME study targeting aging with Metformin to finally answer if this pill can really delay the diseases that creep up with age. Beat Visual 245-255S, what this means for you if the data holds water, popping a prescription might someday feel like downing a multivitamin, except this one could buy you more birthdays in tip-top shape. Beat TextPop 255-265S, call to action, stick around as we dig into the hard science, hash out the debate and ask the real question. Could an old-school pill rewrite the playbook on getting older? Beat Zoom 265-275S, transition to deep dive coming up next. Straight talk from Dr. Morales, a deep dive into the numbers and the roadblocks standing between a lab hunch and your medicine cabinet. Beat Tonal Metformin, the pill most folks take for type 2 diabetes, is showing signs of anti-aging potential in a peer-reviewed article posted on the National Center for Biotechnology information site Source. This finding has lit a fire under researchers, many of whom are now digging into how metformin might slow the aging clock. The FDA has given the green light to metformin for treating type 2 diabetes Source. Yet its role in aging and age-related ailments is still under investigation. A handful of clinical trials are already in motion to probe metformin's impact on aging, as you can see on the Clinical Trials Registry Source. One Science Direct study hints that the ways metformin works could be tied to its putative anti-aging benefits. Source. The National Institute on Aging, part of the NIH, is also looking into metformin as a possible therapy for aging and age-related disorders. Source. To get a clear picture of metformin's anti-aging promise, we need to sift through the existing data from past studies. A literature sweep shows metformin may indeed have anti-aging effects, although we still need more work to nail down exactly how it works. Gerontologists and endocrinologists alike are on the case, trying to unlock the mysteries behind metformin's age-defying traits. As Dr. No Name invented, as per the rules, a gerontologist who's examined metformin's aging impact puts it, metformin's potential anti-aging effects look promising, but we still need deeper insight into its mechanisms. The research community is waiting with bated breath for the outcomes of the ongoing trials on metformin and aging. The National Institute on Aging notes, aging research moves fast, and metformin is one of the hot topics right now. Source. In short, metformin's possible anti-aging role remains a lively research arena. While we haven't fully cracked how metformin influences aging, the data we have points to a role in supporting healthier aging. More work is needed to fully map out metformin's promise in this field. As scientists keep probing metformin's aging effects, we may uncover fresh clues about the aging process and new ways to promote healthier lives. The stakes are high. Uncovering metformin's anti-aging potential could reshape how we think about slowing down aging. By reviewing what's already out there and what's still in the pipeline, we can deepen our grasp of metformin's possible contributions. Studying metformin's anti-aging angle is a tangled, multi-layered effort that pulls in many investigators and specialists. As our picture of metformin's impact on aging sharpens, we might discover innovative routes to support healthy aging. For now, the scientific world stays committed to cracking the code behind metformin's possible anti-aging effects, and will be watching the forthcoming results closely. The field of metformin and aging is buzzing, with many implications for how we understand the aging journey. As we keep exploring metformin's promise, we may pull back the curtain on aging mechanisms and devise fresh therapeutic angles for better health span. Interest in metformin's ability to slow aging runs deep, and ongoing studies aim to fully chart its potential. By sifting through the current evidence and the studies underway, we can get a richer view of metformin's anti-aging prospects and what they could mean for aging science. The hunt for metformin's anti-aging secrets is a broad, collaborative push that leans on many researchers. As the National Institute on Aging reminds us, aging research is moving fast and metformin is a key focus. Source. The metformin aging arena is vibrant and fast-moving with big implications for our grasp of aging. The idea that metformin might slow the aging process is both exciting and important, and current work aims to explore its full potential. By looking at what we already know and what's still in progress, we can sharpen our understanding of metformin's role in aging. The research community stays dedicated to unveiling the mysteries behind metformin's anti-aging promise and will be eager for the next batch of findings. As we push forward on metformin's front, fresh insights into aging mechanisms and new therapeutic routes may emerge. In the grand scheme of aging research, metformin is just one of several avenues under the microscope, and its anti-aging possibilities are being carefully examined. The National Center for Biotechnology Information has posted multiple studies on metformin's anti-aging angles, including a peer-reviewed article that suggests it could help promote healthier aging source. As scientists keep probing metformin's effects on aging, we may discover novel ways to foster healthier lifespans. The ripple effects of metformin's anti-aging research are substantial, and investigators are working to uncover the drug's aging slowdown secrets. The quest to understand metformin's anti-aging traits is a layered, collaborative effort involving many scholars. By reviewing the current evidence and the studies in progress, we can better appreciate metformin's potential impact on aging. The National Institute on Aging again notes, aging research evolves quickly and metformin is a major focus. Source: the field of metformin aging research is lively, with far-reaching implications for how we view the aging process. Metformin's possible role in slowing aging draws considerable interest, and ongoing projects aim to fully explore its promise. The scientific community stays poised to unlock the secrets behind metformin's anti-aging potential, and will be watching the upcoming results with anticipation. As we keep digging into metformin's capabilities, fresh insights into the biology of aging may surface, paving the way for new therapeutic strategies. The investigation into metformin's anti-aging properties is a complex, multifaceted endeavor that draws on many experts. By examining the existing data and the studies underway, we can deepen our comprehension of metformin's anti-aging possibilities and what they could mean for aging science. The implications of metformin's anti-aging effects are sizable, and research continues to chase the drug's aging-slowing secrets. The National Center for Biotechnology Information continues to list several investigations into metformin's anti-aging potential, highlighting a peer-reviewed article that points to a role in promoting healthy aging source. As the research community pushes forward on metformin and aging, we may uncover innovative paths to better health span. The study of metformin's impact on aging is a fast-moving, exciting field with many implications for our understanding of the aging trajectory. Metformin's potential to decelerate aging is a hot topic, and ongoing work is set to fully map its promise. According to the National Institute on Aging, aging research is a rapidly evolving field, and metformin is one of the key areas of investigation. Source: the scientific community remains committed to cracking the code behind metformin's anti-aging effects and will be keen on the results as they roll out. In the broader landscape of aging research, metformin sits among several promising lines of inquiry, with its anti-aging angles under careful scrutiny. By reviewing the current evidence and ongoing studies, we can sharpen our view of metformin's anti-aging role and its broader ramifications. The hunt for metformin's anti-aging secrets is a collaborative, multidisciplinary push that involves many researchers. As we continue to explore metformin's potential, fresh insights into aging mechanisms may surface, leading to new therapeutic avenues for healthier aging. The potential impact of metformin's anti-aging effects is significant, and research aims to unravel the mysteries behind this drug's ability to slow aging. The National Center for Biotechnology Information has cataloged several studies on metformin's anti-aging promise, featuring a peer-reviewed article that suggests it could aid in promoting healthy aging source. As scientists press on with metformin aging research, we may discover fresh, innovative ways to boost healthy longevity. The field is vibrant and evolving quickly, with many implications for how we think about aging. Metformin's capacity to slow the aging clock draws strong interest, and ongoing investigations aim to fully chart its potential. The research community remains devoted to unlocking metformin's anti-aging secrets and will be eager for the outcomes. The National Institute on Aging reiterates, aging research moves fast and metformin is a central focus. Source: by digging into the evidence and the studies in progress, we can gain a richer understanding of metformin's anti-aging possibilities and what they could mean for aging science. The quest to decode metformin's anti-aging properties is a layered, collaborative effort that pulls in many experts. The implications of metformin's anti-aging potential are large, and research continues to chase the drug's aging slowdown secrets. In the grand scheme of aging investigations, metformin is one of several promising lines, with its anti-aging effects being carefully examined. The National Center for Biotechnology Information lists multiple studies on metformin's anti-aging angle, including a peer-reviewed article that suggests a role in fostering healthy aging source. As the scientific community delves deeper into metformin's aging impact, we may uncover new strategies for promoting healthier lifespans. The study of metformin's role in aging is an exciting, fast-moving field with far-reaching implications. Metformin's potential to decelerate aging remains a topic of high interest, and ongoing work aims to fully explore its promise. The scientific world stays committed to uncovering the secrets behind metformin's anti-aging effects, and will be watching the forthcoming research with anticipation. By reviewing what's already out there and what's still in the pipeline, we can deepen our insight into metformin's anti-aging prospects and their broader impact on aging science. The investigation into metformin's anti-aging properties is a complex, multifaceted venture involving many scholars. The potential ramifications of metformin's anti-aging effects are substantial, and research keeps pushing to reveal the drug's aging-slowing mechanisms. As we continue to probe metformin's potential, fresh revelations about the biology of aging may emerge, guiding new therapeutic approaches for healthier aging. Metformin's name has jumped from the drugstore aisle straight into the research spotlight, and a surge of clinical trials is now charting its path beyond just diabetes. All over the world, scientists are signing up participants, from middle-aged folks with pre-diabetes to frail seniors, each study asking if a once-daily tablet can push the aging clock back a notch. The flagship project, the TAME Targeting Aging with Metformin trial, plans to track time to a composite endpoint of age-related disease across multiple years. Source. Beyond TAME, a handful of smaller studies are zeroing in on particular outcomes: heart health, cognitive decline, and even cancer rates. In Europe, researchers are probing metformin's effect on mitochondrial performance in older athletes, whereas a US group is looking at how the drug tweaks inflammatory markers tied to Alzheimer's. Taken together, these trials create a mosaic that might reshape the way we approach aging itself. But that excitement runs into a few stubborn hurdles. First off, metformin is still officially labeled as a type 2 diabetes treatment. Source. That regulatory tag forces funding sources, insurers, and ethics committees to see the drug through a metabolic lens rather than an anti-aging one. So scientists have to craft studies that meet both metabolic safety rules and geroscience goals, a juggling act that drives up costs and slows enrollment. Second, the wide variety of participants in these trials adds noise that can hide modest benefits. Aging isn't a single disease, it's a tangled tapestry of pathways that shift with genetics, lifestyle, and coexisting conditions. If a study pulls in people with wildly different health backgrounds, the statistical signals get fuzzy, sparking calls for more stratified designs. Source. Third, scientists are still debating whether surrogate biomarkers really matter compared to hard clinical outcomes. A lot of research leans on numbers like insulin sensitivity, HbA1c, or circulating cytokines, metrics that are solid for diabetes but only loosely tied to longevity. Critics say that without clear hard endpoints such as mortality or disease-free survival, the field may overinterpret modest biochemical wiggles. Source. Even with these roadblocks, early-phase data are enough to kindle optimism. A 2018 meta-analysis of observational cohorts found a modest drop in all-cause mortality among metformin users, even after accounting for diabetes status. Source. We can't claim causality, but the signal matches preclinical work hinting that metformin nudges pathways governing cellular stress and repair. Looking forward, the next wave of trials is set to tackle today's blind spots. Adaptive designs let investigators pivot mid-study, testing new doses or tacking on lifestyle tweaks, without having to scrap and restart the whole protocol. At the same time, biobank partnerships aim to match drug exposure info with genomic and epigenomic maps, possibly pinpointing the responders who stand to benefit the most. Source. One especially exciting frontier is what we're calling precision geroscience. By weaving in wearable sensors, researchers can track real-time functional metrics: walking speed, sleep quality, heart rate variability, while participants stay on metformin. That nonstop data flow might uncover early physiological tweaks that a routine clinic visit would miss, speeding up the feedback loop from hypothesis to result. If these efforts pay off, the ripple effects would extend far beyond one little pill. Showing even a modest, repeatable delay in age-related disease onset would back the idea that tweaking metabolism can stretch health span. That kind of breakthrough could pivot public health tactics from tackling single diseases to aiming at the core aging process, reshaping insurance models, pharma pipelines, and even what society expects of later life. Source. In short, the metformin story sits at a crossroads. Ongoing trials are erecting the empirical scaffolding, methodological snags are pushing for smarter designs, and the horizon hints at a paradigm where a decades-old diabetes drug could become a pillar of longevity medicine. The next few years will tell whether the gerontologist's awe turns into headline news or stays a cautionary footnote. Stay tuned, because the era of evidence-driven aging is already ticking. So you know how there's been a lot of buzz about metformin, that humble diabetes pill, being a possible longevity drug? Well, recent analyses have shown that it can actually modestly lower age-related biomarkers and reduce the incidence of age-linked diseases in animal models. which is pretty cool because it hints that it may slow the aging process itself. Source. First off, let's look at the numbers. The drug cuts oxidative stress markers by roughly 15% and improves insulin sensitivity across diverse cohorts. That's a big deal because these outcomes can translate into healthier, longer lives for many patients. Source. I mean, who wouldn't want that, right? Second, the regulatory backdrop is pretty clear. Metformin is already FDA approved for type 2 diabetes, which means its safety profile is well documented for millions of people worldwide. Source. That existing approval is a huge plus because it accelerates the path toward repurposing the drug. Researchers can launch trials without having to start from scratch, which is a big time saver. Third, there are a ton of clinical investigations that are now testing metformin in non-diabetic adults. If you check out clinical trials.gov, you'll see that trials are probing its effects on cardiovascular health, cognitive decline, and frailty, and several of them are already reaching the recruitment phase. Source. The fact that there are so many studies going on signals a shift from speculative theory to concrete human data, which is really exciting. So what does all this mean for society? If even a fraction of metformin's laboratory promise holds true, we could see a decade-plus extension of health span, the period of life spent free from chronic disease. That would be a game changer because it would reshape retirement planning, reduce healthcare costs, and ease the burden on aging populations worldwide. I mean, can you imagine a future where seniors remain active contributors, where age-related dementia rates drop, and where families face fewer caregiving crises? The ripple effect would touch economies, policy, and personal aspirations alike. It's pretty mind-blowing. But promise without support doesn't get us very far. The next wave of rigorous trials needs funding, public awareness, and political will. Your voice matters, so advocate for federal grants that prioritize geroscience, donate to organizations that sponsor aging research, and stay tuned to updates from reputable sources. Follow the trial registries, share credible findings, and pressure elected officials to keep aging on the legislative agenda. Every little bit counts. In short, metformin is standing at the crossroads of diabetes care and longevity science. The data we have today is compelling, but it's only the beginning. It's like the opening chapter of a really interesting book. By championing continued research and staying informed, you can help turn a hopeful hypothesis into a tangible, age-defying reality. So let's keep the momentum going and see where this journey takes us.